Good morning and welcome to our webinar, Managing Human Resources During a Public Health Crisis. I'm Melissa Keene, a program manager at the Institute for Local Government, and I will be your moderator this morning. Local agencies are working hard to balance the physical and emotional well-being of their employees while still delivering essential services to their communities. Today's webinar will cover issues that local governments are dealing with during this time of uncertainty and adjustment, including the Families First Coronavirus Response Act, other leave issues, pay and scheduling, collective bargaining, and disaster service workers. A brief overview of today's agenda. So we're going to do a quick overview, talk about some logistics of today's webinar. I'm going to share a little bit of information about the Institute for Local Government. We'll hear presentations from Peter Brown and Alex Wilberding from Liebert Cassidy Whitmore. We'll have time for some Q&A, and then I will share our contact information so that you all can follow up as needed. Your lines have all been muted for the duration of this webinar, but you can ask a question at any time. You should see a questions box on the right-hand channel of your webinar screen this morning. Feel free to type in a question at any point in time, and we will get to those during the Q&A period at the end of the webinar. We will get to as many questions as possible, but if we don't get to your question, we can definitely follow up as needed. A little bit about ILG. We are the nonprofit training and education affiliate of the League of California Cities, the California State Association of Counties, and the California Special Districts Association. We provide practical and easy-to-use resources so local agencies can effectively implement policies on the ground. We provide training and education, convening services, technical assistance, and other resources in a variety of issue areas to local governments statewide. Our topic areas include civics education and workforce, which helps create the pipeline to public service, facilitate municipal school relationships, and help encourage students to think about local government as a career path. Our public engagement program covers everything from getting started to dealing with difficult meeting participants, the use of technology, to authentically engaging your community around a number of issue areas. Our Sustainable Communities program covers things like housing and land use, to greenhouse gas emissions and energy efficiency. And our leadership and governance program, of which this is part of, provides training and resources on state mandates and requirements such as AB 1234 and harassment prevention training, and also resources to help local agencies operate more effectively, develop leadership skills, and increase public trust. We have a number of free resources I just wanted to mention this morning. We have created a COVID-19 webpage on our site. The link is there that has a whole host of local government resources, state and national resources, state executive orders, tools and training opportunities, and highlights a number of local government responses about all of the amazing things you guys are doing statewide to address this crisis. As I mentioned, we have a number of ethics resources on our website, a number of AB 1234 training options, as well as publications on things like the Brown Act, Political Reform Act, Form 700 filing, and more. And then the leadership and governance side of this work has information and resources on effective councils and boards, decision-making, responsibilities and powers, and a number of other things. So a high-level overview of where we are right now. This data is a couple of days old, but as of March 31st, there were over 8,000 positive cases in the state of California alone. And as I'm sure you all are aware, the stay-at-home except for essential needs order was issued on March 20th. Our affiliates, the League and CSAC, have both developed resource pages that are interactive maps to help you get more information about what your city, county, or region is doing in terms of emergency declarations or other orders. Definitely encourage you guys to check those resources out if you're interested more in what your area is doing. Our presenters this morning are Peter Brown and Alex Wilberding. Peter has been involved in all areas of Liebert Cassidy Whitmore's practice since 1989. His career has evolved from representing public agencies in litigation and all types of administrative hearings to now where he spends most days at the collective bargaining table or at a city council or board meeting advising on labor negotiations. In addition, Peter is the chair of the firm's labor relations and wage and hour practice groups. A prolific trainer, Peter speaks at numerous conferences throughout the state of California and nationally on public sector labor and employment law topics. Alex is an associate in Liebert Cassidy Whitmore's LA office, where he provides assistance to clients in labor relations matters as well as employment law. Alex has a background in government and policy and provides clients advice and counsel on traditional labor relations issues, including collective bargaining, allegations of unfair practices, representation matters, and work stoppages. Alex is also a regular contributor to the firm's blog and frequently authors articles for Lieber Cassidy Whitmore's clients. And so with that, I'm going to turn it over to Peter to get us started.
Good morning, everybody. First workshop I've ever done from my house. Hopefully there won't be people blowing weeds around or dogs barking, but we'll do our best. We're all in this together, and there is so much information coming at us every single day at a very, very fast pace. And because of that, for example, yesterday the Department of Labor issued their temporary regulations, which answered a lot of the questions that many of you have had over the last week and a half, 2 weeks since the Family's First Coronavirus Response Act was signed into law. Alex is going to start us off here talking about the law itself, and then what we're going to do after that is just talk about some of the what I would describe as key issues or issues that public agencies have been asking us at a breakneck speed over the last couple of weeks. So Alex, get us started.
Thank you. As Peter mentioned, on March 18th, President Trump signed into law the Family's First Coronavirus Response Act. As Peter mentioned, that law went into effect yesterday, April 1st. Among other things, the act includes two sub-acts which provide new leave and pay entitlements to eligible employees. The first of those acts is the Emergency Family and Medical Leave Expansion Act, which expands the scope and benefits provided under the FMLA. The second act is the Emergency Paid Sick Leave Act, which provides a federal entitlement to certain leaves associated with COVID-19. A bit of overview on the Family's First Act. This law covers all public employers, regardless of their size, and the leave benefits provided under the act apply to the vast majority of public employees. At this time, there's no law requiring that the federal government reimburse public agencies that must comply with the act. Congress may consider trailing legislation to provide for such reimbursement, but as of this presentation, the federal mandates are unfunded. Yesterday, as Peter mentioned, the Department of Labor issued temporary regulations concerning leaves and pay provided for under the FFCRA. The Department of Labor previously provided that until April 17th, it would not enforce compliance with the act so long as the employer acted reasonably and in good faith in their attempt to comply with the leave provisions. Therefore, it's imperative that public agencies implement FFCRA compliant policies and provisions immediately. As I mentioned, the Family's First Act is comprised of a number of other acts, including the Emergency Family and Medical Leave Act, which expands the scope and benefits provided under the FMLA. I will refer to the leave provided under this act as Public Health Emergency FMLA leave. Public Health Emergency FMLA leave entitles eligible and qualified employees to take up to 12 weeks of leave at 2/3 of their regular rate of pay, up to $200 per day and $10,000 in the aggregate. We'll discuss this more in a moment. In terms of the eligibility for employees to receive this FMLA, Public Health Emergency FMLA leave and the pay associated with it, the employee must be employed by the employer for at least 30 calendar days prior to the receipt of such leave and compensation. The act does not limit the coverage to full-time employees, so part-time, temporary, seasonal, and provisional employees would be covered as well, so long as they've been employed for at least 30 days, as would retired annuitants returning to the workforce. This leave provides for one qualified reason in order to receive this benefit, and that is that the employee must be unable to work or telework due to the need to care for the employee's son or daughter who is either under 18 years of age or 18 years of age or older, but unable to provide self-care due to a mental or physical disability. and whose school or place of care has been closed due to a COVID-19 related emergency as declared by a federal, state, or local authority. This leave also applies where the normal child care provider is unavailable due to a COVID-19 emergency. I'll discuss the leave provisions here. How much FMLA public health emergency leave is an employee eligible to take, and is the leave paid or unpaid? So employees have the right to take up to 12 weeks of job protected public health emergency FMLA leave. The initial 10 days of this leave may consist of unpaid leave. However, an employee may elect to substitute any accrued vacation leave, personal leave, or medical or sick leave for this unpaid portion. Further, and as we'll discuss in a moment, an employee may elect to use emergency paid sick leave during this first 10-day period that is otherwise unpaid under the public health emergency FMLA leave. From the 11th day on, so essentially the 3rd through 12th weeks of this leave, the employer must provide paid leave in an amount not less than 2/3 of an employee's regular rate of pay for the number of hours that the employee would otherwise normally be scheduled to work during this leave time. However, as I mentioned earlier, this leave is capped at $200 per day and $10,000 in the aggregate for that entire 12-week period. There's some question about how this leave interacts with normal FMLA leave. The Department of Labor answered this question yesterday in their regulations. And this leave, the expanded FMLA leave, runs concurrently with the normal FMLA leave, such that an employee who's using the public health emergency leave would draw down their FMLA leave allotment as well. There's some question as to how the FMLA public health emergency leave interacts with the California Family Rights Act. We'll discuss this in a little bit. It's not entirely clear at this time, however. In terms of notice, public health emergency FMLA leave requires that when the need for leave is foreseeable, the employee must notify the employer of the need for leave when it is practicable to do so. It doesn't, the statute nor the regs provide for circumstances when the leave is unforeseeable. A last point on the Emergency Family and Medical Leave Act. This act provides, just as with normal FMLA, that employees who utilize this leave are entitled to reinstatement upon their return to work after the conclusion of the use of such leave. Turning now to the Emergency Paid Sick Leave Act. This is the second act of that we'll be discussing with respect to the Family First Act. This act provides a federal entitlement to up to 80 hours of paid leave to full-time employees for certain purposes related to COVID-19. This leave is separate and distinct from any leave to which employees may be entitled either by statute or by contract. Therefore, public agencies should provide this emergency paid sick leave on a supplementary basis and should not run it concurrently with statutory or contractual leaves to which the employee is entitled. The eligibility for receipt of Emergency Paid Sick Leave Act differs from the Public Health FMLA leave. All employees are eligible for Emergency Paid Sick Leave Act. There's not a 30 calendar day requirement that there is with the public health emergency leave. The Emergency Paid Sick Leave Act, like the Public Health Emergency Leave, does not require that an employee be a full-time employee. So again, part-time, provisional, temporary, seasonal employees will also qualify. The regulations that the Department of Labor issued yesterday provide the methodology by which employers can determine how much paid sick leave part-time employees are entitled to under the Emergency Paid Sick Leave Act. This act, unlike the public health emergency FMLA leave, provides for 6 qualifying reasons. And the benefits provided under the act depend on how the leave is used, so this gets a little complicated. Employees are entitled to emergency paid sick leave at their regular rate of pay, subject to a cap of $511 per day and $5,110 in the aggregate if they are unable to work or telework due to one of the following reasons. 1, the employee is subject to a federal, state, or local quarantine or isolation order related to COVID-19. 2, the employee has been advised by a healthcare provider to self-quarantine due to concerns related to COVID-19. And 3, the employee is experiencing symptoms of COVID-19 and is seeking a medical diagnosis. Employees are entitled to emergency paid sick leave at 2/3 of their regular rate of pay, subject to a $200 per day cap and $2,000 in the aggregate if they are unable to work or telework due to one of the following 3 reasons. The employee is caring for an individual who's subject to one of those isolation or quarantine orders, or is caring for an individual who has been advised by a healthcare provider to self-quarantine due to COVID-19. The second of these 3 reasons is that the employee is caring for his or her son or daughter because the son or daughter's school or place of child care has been closed due to a COVID-19 related order. And that is the same reason as leave under the public health emergency leave is provided. And I'll explain the interaction between these 2 leaves here at the end of this slide. The third qualifying reason for the 2/3 pay entitlement under the Emergency Paid Sick Leave Act is a yet to be defined term that depends on a designation by the Secretary of Health and Human Services and relates to symptoms substantially similar to that of COVID-19. The Secretary of Health and Human Services is not provided for that designation of those symptoms, so we won't discuss that here. In terms of the notice required for usage of such leave, after the first day on which an employee uses, actually this is for emergency paid sick leave, a public agency may require the employee to follow reasonable notice procedures. And the regulations further provide that the documentation that an employer must obtain from employees utilizing such leave. In terms of the interaction between the leaves, as I mentioned, during the first 10 days or 2 weeks of the public health emergency FMLA leave, that leave is unpaid under that act. However, employees are entitled to utilize Emergency Paid Sick Leave Act under that 5th qualifying reason in order to take care of a son or daughter whose school or child care facility is closed. One other final point on the Emergency Paid Sick Leave Act. There is no carryover of any unused emergency paid sick leave balance at the expiration of the Family First Coronavirus Response Act, which expires on December 31st, 2020, such that if an employee has a remaining balance at the end of 2020, the employee is not entitled to roll that over for use in 2021. Furthermore, employees are not entitled to cash out any unexpended emergency paid sick leave balance that they do not use prior to the end of 2020. And I think now we're ready to discuss some hot topics. So in terms of one of the common issues that comes up are leave entitlements for part-time employees, as I mentioned on the first slide. The Department of Labor defines a full-time employee as an employee who's normally scheduled to work at least 40 hours per week. As I mentioned, Emergency Paid Sick Leave Act entitles full-time employees to receive up to 80 hours of paid sick leave under this act. The Emergency Paid Sick Leave Act generally entitles part-time employees to receive up to the number of hours that they would normally work on average over a 2-week period, although some special rules apply to part-time employees who have varying schedules. For those employees with varying schedules, the regulations that are issued by the Department of Labor require that the employer look back over a six-month period to calculate the average number of hours that an employee would work in a normal 2-week period. For employees who have not worked for an employer for 6 months, the employer should look back at the amount of time that they've been employed by the employer.
Okay, so let's talk about, good morning, everybody. Let's talk about use of paid leave to supplement FFCRA leaves. So this is obviously a hot topic because the pay that is provided to employees under these acts for many public employees in California does not fully pay them. And so the question is, are they entitled to use their accrued leaves? So for the first 10 days of this leave, where everyone's going to be using their emergency paid health leave and sick leave, you have to allow employees to supplement with their accrued leaves to get up to their full pay. After that, once we're into week 3 through 12, and the employees are getting 2/3 of their regular pay, assuming they're home on health leave, then the question is, or at least the way the regulations provide, is that it's up to the employer to decide whether to allow employees to use accrued leaves or not. And so that means that you can say, nope, you can use your emergency paid health leave, period, or you can say you can use your emergency paid health leave to get you X dollars, and then the rest of the money can come from accrued paid leaves, but that is not a mandate that's provided for under the law. So that's something you're going to have to determine internally at your agencies as to whether or not you want to allow the use of accrued leaves concurrently with leave under the emergency paid health and sick leave. Alex?
So turning to the intermittent use of leave provided under FFCRA, there's one kind of umbrella condition that applies to all leaves under the Act, and that is that both the employee and the employer must agree to allow the use of intermittent use of leaves under these sub-acts. Absent such an agreement, no leave under the FFCRA may be taken intermittently. The regulations don't require that the employer and employee reduce this agreement to writing. However, in the absence of a written agreement, there must be a clear and mutual understanding between the parties that the leave may be taken intermittently. And where there is such an agreement, the employee and employer must further agree on the increments of time by which leave may be taken. In the circumstance where an employee is teleworking and therefore not using FFCRA leave, the employee may intermittently use such leave at his or her discretion, subject to an agreement on just that incremental use of leave time. Peter?
Yeah, so the issue of intermittent use of this leave may actually become a collective bargaining issue. because since it's been left to the employer and employees to agree, your employee associations may raise this as something that they want to discuss. So keep that in mind. And this is not something that I believe, and we'll talk about this, about the emergency exception. I don't think this is something that is going to fit into the emergency exception. So, but also, and you'll hear about the emergency exception in just a bit, there isn't a lot of time to discuss this since this is happening right now. But I do want to talk, there's 3 bullets here about employer closes the work site, employer reduces work hours, or leave entitlements for workers with reduced work hours. So this is a little bit different than the fact that you've sent that employees have been sent home by the stay-at-home order from the governor. So we had a lot of questions before yesterday about whether the stay-at-home order was an isolation order or quarantine order, and then the Department of Labor clarified that in their regulations, saying indeed it is, a stay-at-home order does qualify. And so if you have non-essential employees and that work is sitting there and they're home, they qualify for leave under the FFCRA. But if you have employees, for example, you have recreation employees or other services that have literally stopped, meaning in light of COVID, you're not providing these services. You have either closed a work site, or you have, like for as needed employees, said you don't need to come back to work until we have hours for you. In that situation, employees are not entitled to FFCRA. And the difference here, and it may sound like a subtle distinction, but it's an important distinction. There's a difference between sending non-essential employees being sent home as a result of the stay-at-home order. They qualify, as opposed to saying, we are shutting down this service, and by shutting down this service, we are not providing this service, and therefore we have no hours for employees. Now, you'll have to look at your collective bargaining agreements, because that could theoretically cause a furlough. And if you're furloughing employees, that's a mandatory subject of bargaining, and that's different than this. This is unrepresented employees who have not bargained for a particular work schedule, where you close down a work site and say we are not providing this service. They don't qualify for leave under the law while they're not working. And if their hours are reduced, they qualify for a proportionately reduced number of hours. Alex?
So turning to the calculation of the regular rate of pay for leave compensation, the FFCRA defines the term regular rate of pay using the definition under Section 7 of the Fair Labor Standards Act. Under the FLSA, an employee's regular rate is computed for each work week as all non-overtime remuneration for employment paid to the employee, except for certain statutory exclusions, divided by the number of hours worked in that work week. The statutory exclusions with which your payroll personnel will be quite familiar here are several of them. This is not the comprehensive list of the 8 statutory exclusions, but gifts are excluded, payments for when no work is performed, such as when the employee is on vacation or on holiday or due to illness, and reimbursable business expenses may be excluded. The regulations require an employer to use an average of the employee's regular rate over multiple work weeks due to that fluctuation in the regular rate per work week. And as such, the employer should weight those calculations based on the number of hours worked in each work week. The Department of Labor regulations provide that the computation of the average regular rate should look back 6 months, and with a period ending on the date on which the employee first takes paid sick leave or expanded family and medical leave. So the 6-month look back is triggered by the usage of leave under FFCRA. And the employer should appropriately weight that regular rate calculation based on the number of hours worked. And where the employee has not worked for the employer for 6 months, again, the average regular rate should be computed over the entire term of that employee's employment.
Let me just say something about regular rate. As many of you know me and my involvement with this topic, this particular aspect of the regulations is, in my opinion, preposterous. Asking payroll folks to calculate 6 months worth of regular rate to figure out what the regular rate of pay is so much additional extra work. Most of your employees have a standard regular rate of pay, and I'm fairly confident that if you use that regular rate of pay for the things that they regularly receive as part of the regular rate of pay, you'll be fine. Okay. Emergency responders and healthcare providers. So we all know that this was an exclusion from the FFCRA. It was included in the law. We all saw it when it was signed on the 18th, but when we got 1,000 questions about who qualifies for an emergency responder and a healthcare worker, because most of us have at least emergency responders working in our agencies. And yesterday, the Department of Labor gave us very broad definitions of emergency responder and healthcare providers. And what I would tell you is that if you're an agency, I mean, today's the second day of the law, right? So if you're an agency who has made a decision to exclude emergency responders from this law, you should look at the definition. I mean, I'll just tell you the definition is law enforcement officers, correctional institution personnel, firefighters, emergency medical service personnel, physicians, nurses, public health personnel, emergency medical technicians, paramedics, emergency management personnel, 9/11 operators, child welfare workers, and service providers, and public works personnel. And so what you should do if you are excluding emergency responders, which from what I can tell is most public agencies are because they need these people to come to work, is put a list together, okay, and make sure that the list is communicated to your employees so that the employees who are excluded are indeed excluded. And the same thing applies to healthcare providers. The definition for healthcare providers is any individual capable of providing healthcare services necessary to combat the COVID-19 public health emergency. So you can see that's even broader. I have heard of one agency who's giving this benefit, who's not excluding certain public safety personnel. I'm not exactly sure why, but this leave is because people can't come to work. With respect to your first responders, you need them to come to work. And so, although it's a policy decision and not a mandate, you should seriously consider excluding emergency responders as broadly as you possibly can. Okay? Alex, I think we've spoken about the isolation order, but why don't you just finish us off on this slide?
Sure. So the executive order that Governor Newsom issued on March 19, the Department of Labor confirmed yesterday that Executive Order 3320, which is that executive order, constitutes an isolation or quarantine order. Therefore, all public agencies in the state are subject to that order, such that employees may qualify under the first, fourth, or fifth qualifying reasons for the emergency paid sick leave.
Okay, thanks. If you can move the slide, please. Thanks. So I want to talk very briefly about some of the other leave issues that we've been dealing with. First one being use of paid leave accruals. So literally right before this webinar, someone texted me, emailed me, and they emailed me the question, hey, we have an employee whose daughter was exposed to COVID-19. What should we do? And my response was, well, given that this person has been exposed, you should tell the employee to and this was not an essential worker. So you should, this was an essential worker. So I said, okay, have the employee go home, have the employee use paid leave, but if the employee, you should offer the employee the opportunity for post-deprivation procedural due process under a case called Bostean, Bostean versus Los Angeles Unified School District, which gives the employee the opportunity to say after the fact, I wasn't sick, you sent me home, I should get my leave accruals back. So that's the situation when you're dealing with somebody who has been exposed. We were also dealing with this Bostean case right as COVID-19 hit, when people were coming back from international travel. We're not really seeing that now because most people haven't been on international travel for the last 2 to 3 weeks. And so you're going to mostly deal with that issue when you're dealing with people whose family members have been exposed, right? The issue of possibly having to give people due process. Let's talk about paid administrative leave, right? So a lot of agencies are being very benevolent, right? They're giving employees more leave than the law entitles them to, and they're saying you can just stay home unpaid, right? And you don't have to run any leave accruals. This is your right. I mean, this is the question is it a gift of public funds, or does it meet the public purpose exception under the California Constitution? We believe it does. But, and this is, your elected officials will have to make all the policy decisions. But with most agencies, sales tax revenues, going diving, most agencies who rely on TOT having like between 0 and 5% occupancy in their hotels, they're seeing a dramatic decrease in their, at least initially, with their flows of revenue. And so paid administrative leave, you got to balance that against the benevolence of your agency and providing people with time off where they have leave accruals, and they now have the ability to use the FFCRA. Advancing leave and negative leave accruals. I'm seeing a lot of agencies doing this, increasing the caps on your vacation and on your vacation leave, because people aren't going to be able to use vacation, allowing people to run into negative leave accruals. If you're going to do this, just put together a side letter with your employee associations. This does not fit into any emergency exception, saying, hey, this is what you want to do. No employee association is going to say no to this. This is a positive thing, okay? And so an idea that I'm hearing a lot of agencies using. As far as unpaid leave is concerned, once the 80 hours of FFCRA sick leave is exhausted and we get into this emergency paid health leave, and you don't have a child who's home who you're taking care of, a lot of people are going to go and start using their leave balances starting in the middle of this month. And once we get into that situation, you're going to have people who are going to have to continue to be employed if you're going to continue to maintain their service, like into May or whenever this pandemic ends. You'll have to consider allowing people to use unpaid leave, and it shouldn't be subject to the same standards as in the past when people ask for unpaid leaves of absence. The next thing I want to just mention is the industrial causation and workers' comp issues. So there's several employee groups out there right now who are asking agencies to sign agreements that this is industrially caused. COVID-19 has industrial causation. As of right now, as we speak, it is not a presumption that that COVID-19 is industrially caused. However, there is a whole bunch of lobbying work right now being done to get that presumption. What I would say to you at this point is, if someone files a claim, let the claim go through the normal process. If the law changes and COVID-19 becomes an industrially caused or a presumptively caused workers' comp injury, then it'll be a presumptive workers' comp injury. But as far as agreeing to make it presumptively workers' comp, that's again a policy decision. And I'm not going to recommend or not recommend that you do that. That's up to you. But I can tell you that a lot of my clients who have evaluated this issue have determined that their workers' comp carriers have said to them, then you're on your own if you presumptively assume it's workers' comp related. Okay, switch your slide. Thank you. Okay, there we go. So I'm getting a lot of agencies, as I mentioned earlier, who are looking at closing certain facilities. They're closing the library, they're closing down their recreation and parks departments. And the issue with that is, if the employees are unrepresented, you can do that. If the employees are represented, then you have the issue of that's a reduction in hours or a furlough, and reductions in hours and furloughs are mandatory subjects of bargaining. And the question then becomes, can you do that? And can you do that without having to first meet and confer with your employee association? And the answer to that is it really depends. Things like changing someone's schedule from a 410 to a 312 so that we can reduce the exposure of people on crossover shifts, that you can do on per the emergency exception, because you're doing that to avoid the spread of COVID. But if you're talking about reducing people's hours by starting to furlough people, there's such a sparse amount of law on the emergency exception under the Myers-Milius-Brown Act, that if you're doing that without going through your meet and confer obligation, you're taking a risk. My guess is that PERB will be inundated with unfair labor practice charges the minute that this pandemic is over for agencies who overuse the emergency exception. My advice on this would be to go to your employee associations and say, look, we want to start doing furloughs if that's what you need to do. And if what you get is a we're not interested type of reaction, then you may have to consider threatening, and I don't mean it in that way because I don't want to sound awful here, but you may have to consider threatening layoffs as a way of getting the employee associations to actually agree to furloughs. Because if you were to go through a labor negotiations over furloughs, it would take way too long. You need to get this done now. And the only way you're going to be able to argue that a furlough qualifies as an emergency is if indeed it is an emergency fiscally. And if you're sitting on 25% general funds right now and your reserve fund balance, it's going to be harder to make that argument out. And I wish I could give you law that can support what I'm saying here, but I just can't, because we only have one case that I know of, a published California Court of Appeal decision involving Sonoma County dealing with the emergency exception. So reducing staffing and furloughs is definitely something that you can approach your associations with, but whether it qualifies under the emergency exception is unclear. You obviously have employees working from home and telecommuting, and the Department of Labor regulations from yesterday actually even addressed that minimally by saying, hey, you may need to be flexible and in terms of how people work, and they eliminated this continuous work day rule, meaning you can work someone from 7 to 11, from 2 to 3, and 7 at 9 at night, and they get their work day in, and they don't have to be paid for the entire 12, 14 hours during that time period. As far as telecommuting policies, I mean, our clients have been using them, and and of course, the risks associated with all of these things are that you haven't evaluated anyone's home for being a safe work environment. We've just thrown everybody into a telecommuting mode, and we're all sort of hoping for the best. You should probably be utilizing a telecommuting policy if you have it. Alex, why don't you finish us off with essential and non-essential employees?
Sure. So as I mentioned earlier in the presentation, Governor Newsom's executive order imposes a statewide stay-at-home order for non-essential businesses and governmental operations. Exempted from that order are the essential government functions and the individuals needed to perform those functions. So without spending too much time on this slide, the governor's order identifies kind of 16 critical infrastructure sectors and exempts those sectors from the stay-at-home order. And it's incumbent upon public agencies, in order to decide who are their essential employees, to first decide what is the essential function provided by your agency, then determine who are all the employees whose continued service is necessary and required in order to continue to provide that essential function, and then deem those employees essential employees. Further, employers should identify all the employees whose work is necessary to provide sufficient support and staffing to those quote unquote essential employees, and further deem those employees to be essential employees as well. And we recommend that if there's a close question between deeming an employee an essential employee and not, go ahead and deem them an essential employee. And remember, the designation of an essential employee is yours as the employer to make, and it's not the employee's decision. And we recommend that you're deliberate and decisive, and at all times act in the public's best interest in this decision making. Next slide.
Thank you, Alex. Before I talk about collective bargaining, which I will right now, just remember that when you deem someone essential and they're coming to work at your agency, I don't think it goes without saying that you need to ensure that all of the things that we're talking about social distancing and keeping all the wipes around and making sure that people are wearing masks if they're close to each other, all the safety precautions need to be taken, because so many people are home right now, but so many people are at your agencies right now because they are essential and are needed to provide all of us who also live in a community and rely on our governmental agencies for the services that we enjoy at our homes, okay, in our neighborhoods. We're relying on you. And so please take those safety precautions. Okay, collective bargaining. So in the introduction, you heard I'm the chair of the firm's labor relations practice group, and I spend most of my days in collective bargaining. Most of my frequent last days have been spent on Zoom collective bargaining meetings, and I can tell you that it might be the norm for the next several weeks. I've been practicing for 30 years, and I've been at the table this is my 30th year. And I've never used the emergency exception before now. I've had one agency ask me about it a few years ago, and we did an analysis on it. Now I have agencies asking me about it every day. And so we have this language in the Myers-Brown Act allowing you to make exceptions based on an emergency. And then we have very, very, very little case law on this. And so what I'm telling agencies right now about this is that we don't know the scope of how far you can go with the emergency exception. We know that this is the law with respect to the emergency exception. If something fits within the emergency exception, you make the decision first, and then you offer the opportunity to bargain over that decision with the employee associations, which is essentially akin to impact bargaining in the sense that you're negotiating after you've already made the decision, right? Now, in a lot of these things that my clients have been doing in the last week and 2 weeks, the associations have been grateful for the emergency, for the decisions, and have been perfectly fine with the decisions that have been made by the agencies. But if you start to utilize the emergency exception to start cutting people's wages and benefits, you are going to begin to see resistance from the employee associations who want to have a seat at the collective bargaining table before you make those decisions. And what I would say to you is if you're risk adverse, then try to offer the opportunity to meet and confer and implore on the associations, hey, we don't have time to go through a protracted labor negotiations. And at some point, it may actually become a fiscal emergency in your agency, depending upon your resources. But what you can expect to hear from employee groups, as I mentioned before, is that your healthy reserve funds that are in your general funds are, for now, it's raining, it's pouring, it's exactly what the reserve funds were set up for. So what I can say to you is be cautious, be careful, understand you always have the ability to reduce the size of your workforce as you evaluate reducing the labor costs. And if you have emergencies like one I mentioned before, which is making schedule changes to avoid people from being exposed, that I feel very confident in telling you is an emergency. Beyond that, you would have to be able to demonstrate the emergency exists and later theoretically or potentially defend yourself from an unfair practice charge that may be coming down the road years from now. Okay, Alex, why don't you take the next slide?
Sure. So as Peter mentioned, there's a lack of case law and authority on the emergency exception to collective bargaining. There's even less authority on the usage of disaster service workers, unfortunately. The government code provides that all public employees are hereby declared to be disaster service workers. However, that's pretty much the extent of the statutory and regulatory authority on that subject. The Emergency Services Act describes at length some of the disaster service worker volunteer regulations, but does not exactly provide for the authority for employers to use disaster service workers subsequent to the proclamation of a local emergency. Cities and counties do have the authority under the Emergency Services Act to proclaim a local emergency. Many of your jurisdictions have done so already. In terms of how to operate and manage employees as disaster service workers. In the absence of authority on the subject, we are recommending that employers utilize and rely on the emergency exception to the MMBA that Peter just discussed. Peter, do you have anything more on that subject?
Sorry, Alex. Yeah, on as far as dealing with issues related to the to disaster service workers, the big issue with disaster service workers that theoretically we might find ourselves in is the issue of assigning people to jobs that they don't ordinarily do. The question is, are they entitled to out-of-class pay? Well, if your MOU provides for out-of-class pay, then sure. But if your MOU does not provide for out-of-class pay, I would say that your reliance on the emergency exception would be a way of saying, we're assigning you here, we're assigning these library workers to deliver meals to the homeless. We're assigning you folks here in the recreation department to handle these things that they're capable of performing. Obviously, you're not going to have people performing emergency services that they're not capable of performing. But the law allows you to use your employees as disaster service workers, and how the MMBA sort of, you harmonize the MMBA with it is that this is a decision you're making because there is an emergency right now. And as far as the meet and confer obligations related to pay that are caused by that, those are decisions you're making now that you're putting the associations on notice of, which give them the opportunity to then request to bargain over the fact that they're working in classifications that are outside their regular scope. Okay, can you move the slide?
So with that, we have some time for some questions, and I will read some questions, and Peter and I will tackle them together. So the first question, Peter, is did CalPERS clarify that it's okay to give retired annuitants this benefit, and this benefit meaning FFCRA leave and compensation?
Yes. Yes, if you're working them right now, if they're currently working, correct. If they're when you say retired annuitants, they are individuals who you've actually hired back who are working their 960 hours. Yes.
So they qualify as employees under FFCRA and are eligible for the leave benefits and pay benefits thereunder. Next question: Is this leave employer paid?
I just want to make a quick note to the attendees before we jump into the next question. We have already received a number of questions. Feel free to add any additional questions you have into the questions box, but with the short amount of time we have left, we likely won't get to all of them, but we are happy to follow up after the webinar is over.
So the next question is this leave employer paid? And the answer to that question is yes. And as I mentioned at the top of the presentation, currently there's no federal reimbursement for that, the provision of this leave benefit and compensation. It may be something that Congress considers in trailing legislation, but currently the leave and compensation are unfunded federal mandates. The next question is, isn't the max $12,000? And I assume this relates to the Public Health Emergency Leave Act. And this is where you get an interaction between the Paid Emergency Sick Leave Act and the expanded FMLA. So again, the first 2 weeks of the expanded FMLA are unpaid. However, during those 2 weeks, an individual can use emergency paid sick leave. And if they're using emergency paid sick leave to take care of a child whose school is closed or child care center is closed, that employee will receive up to $2,000 for those 2 weeks. Add to that the $10,000 that an employee may receive for the final 10 weeks of the expanded FMLA will give you that $12,000 total. So the $12,000 total reflects usage of both leaves.
Correct.
The next question is, DOL guidelines say the FFCRA covers certain public sector employers. Can you explain more of which public sector employers must comply with the Act? Peter, you want to take that one?
Sure. So if you read those words, then, and it's certain public employee, so if you read those words, the exclusion that the DOL is talking about is the exclusion of employers of emergency responders or healthcare providers. So most of us who have emergency responders or healthcare providers have them as employees within our organization. But there are some organizations like 9/11 dispatch organizations that's all they're just employers of emergency responders, or a public hospital who might just be an employer of healthcare providers. So that's all we're talking about. There's no other limitation. This whole question of if you have 50 or less, that only applies to the private sector. It does not apply to governmental agencies. There are lots of special districts out there that have 20 and 30 employees. I'm sorry, you're all subject to this, even though you're not subject to the FMLA itself. You are subject to this.
The next question is, did you say that the California's executive order to shelter at home is a quarantine order such that employees are eligible to receive the 80 hours of emergency paid sick leave? Yes. The DOL regulations issued yesterday state quarantine or isolation orders include a broad range of governmental orders, including orders that advise some or all citizens to shelter in place, stay at home, quarantine, or otherwise restrict their own mobility. Therefore, Governor Newsom's executive order of March 19 is an isolation or quarantine order such that an employee who is at home and unable to work or telework due to that order and not due to the reduction in work hours or availability of work from the employer would qualify for up to the 80 hours of emergency paid sick leave.
Let me speak to this just also for a minute. So prior to yesterday's temporary regulations coming out from the Department of Labor, I saw lots of agencies receiving interpretations of the law saying, hey, non-essential employees aren't actually even subject to FFCRA leave because the governor's order was not an isolation or quarantine order, and actually defining what isolation is and defining what quarantine is and saying that neither of those things are what the governor did. And like so much of the law that I'm sure many of you have been looking at over the last 2 weeks, there are ambiguities, and looking at the different like law firms or others, people's interpretations of it, it was frustrating to a lot of people. And I had a lot of people arguing with me about, doesn't it mean this? Doesn't it mean that? Come on, Peter, right? And, when I saw that yesterday, I, felt relieved relieved in that that's what we've been saying, but it could have easily gone the other way because isolation and quarantine by themselves don't necessarily mean what the governor did, but the Department of Labor has said yes.
So the next question is more of a request. Please clarify, are quote unquote emergency responders eligible or not for emergency paid sick leave in California?
So the answer, thank you. The answer to that is only if your agency decides to make them covered by the law. They are, the answer, they're not mandatorily excluded, but so that it's up to each employer to decide whether to exclude them, but the employers have the right to exclude them. And so I can envision a situation where a police or fire association is going to come in and say, well, we want to bargain over that issue because, you're giving this benefit to other employees and we're not getting it. And my response would be, that we've made this decision to exclude you, and we have the right to make that decision to exclude you as part of the emergency exception. The law doesn't mandate that you're entitled to this, and if you'd like to bargain with us over our decision, you can. But I would think that an employee association who represents public safety could take the position, we'd like to bargain with you over this issue.
Peter, the next question relates to an issue that we discussed yesterday.
Alex, just one second. I want to do a quick time check with you guys. It is 11 o'clock right now. So I'm going to go ahead and move the slides to our contact information in case people need to drop off. But if you guys have a few more minutes and want to answer some additional questions, I would welcome that as well.
Sure, of course.
So the next question, if an employee has requested public health emergency FMLA leave, are we allowed to ask anything about the other parent's availability to watch the child? For instance, if we know that the employee has a spouse who is not working, can we deny the leave since there is another parent available to watch the child?
You want to take this, Alex? Because you know what we talked about.
So the regulations that DOL issued yesterday do provide that in order to utilize that public health emergency leave, the parent is unable to work due to the need to take care of the child who's home from school or child care. And the regulations further suggest that if there's a co-parent, co-guardian, or other normal child care provider who's available to provide child care and supervision during that time, the employee would not be entitled to utilize that public health emergency leave. That's what the regulations state. I'm not entirely certain how feasible it will be to administer that. Peter, do you want to say anything about the question about whether the employer is allowed to ask anything about the other parent's availability?
So this is a really tough one because, as many of you know, under the existing FMLA, if someone has a child, both spouses are entitled to 12 weeks to bond with the child unless they're both employed by the same employer, in which case the combined total is 12 weeks. You know that, right? I mean, you as the employer know that both partners or spouses of a child are employed by your own agency. Here, now we're getting into the situation of what does the employer know of the employee's partner or spouse's ability to stay home? And being able to know that is going to be difficult. But I think the answer is that you can request that information via a certification form, meaning asking an employee to certify that they need this leave because they need to stay home to take care of a child whose school has closed, and there is not another parent who is able to provide the same care or has the ability to do that as well. How this is going to work from a practical standpoint, especially when we're all home, we don't even know what our employees' spouses or partners' availability is as good a guess as anyone else's.
The next question is a related one. An employee asked to be home to take care of kids who are out of school. Do they have to wait 10 days to take FFCRA pay? So no, they can immediately take, assuming that the school is closed and the child is out of school because of an isolation or quarantine order that's forcing the school to be closed, that employee would immediately be able to take emergency paid sick leave for those first 10 days. After those first 10 days, on the 11th day, that same employee would be eligible to take the public health emergency FMLA leave. But no, the employee can take paid leave immediately, assuming that the child's school is closed due to a lawful order.
Yep.
What about an employee that is exhibiting flu-like symptoms? If we send them home to get tested cleared, does that qualify for FFCRA? Peter, you want to take that?
Yeah. So an employee who is sent home for flu-like symptoms, at that point, you have the ability. So the question is that are they entitled to FFCRA? Is that the question?
I believe so.
Okay. So the answer is, does it fit within one of the grounds? Is the employee being subject to a federal, state, or local isolation order? I would say yes, right? Because if you're sending the employee home, you're telling them not to come to work because of an isolation order. You're ordering them not to be at work. I would say it does qualify as a and the other one is the employee is experiencing symptoms of COVID-19 and seeking a medical diagnosis. So if they're having flu-like symptoms, that is a symptom of COVID-19. So in both cases, that's going to qualify them for emergency paid sick leave. Excuse me.
One point to add to that, the DOL regulations issued yesterday in terms of that third qualifying reason that the employee is experiencing symptoms of COVID-19 and seeking a medical diagnosis. The DOL regulations issued yesterday make it clear that the employee has to be actively seeking a medical diagnosis. So in the case where an employee just goes home and just sits around feeling bad, the employee might not qualify under that qualifying reason number 3. They actually have to be affirmatively seeking that medical diagnosis. Just a small clarifying point.
But that's a good question for purposes of coordinating the issue of we send someone home versus their qualification under the law. Because you remember, I spoke about sending someone home earlier and said people can use their accrued paid leaves and theoretically are entitled to post-deprivation procedural due process. But then this brings in the question of, well, if we send someone home because they're experiencing flu-like symptoms, are we now subjecting them to an isolation order, a local isolation order? And it's, I would say, given the nature of the DOL regulations being fairly broad, that I would say yes, and that would qualify them for emergency paid sick leave if we do that. Okay.
Looking at the remaining questions, it appears that we've answered or touched on the answers to most of them. So if there aren't kind of any unique new questions, I would propose that we answer the remaining questions offline.
Perfect. We can definitely share those with you after we get done here. So again, I have put up our contact information, so feel free to reach out to any of us after the webinar ends if you have any questions or concerns. I will be sending out the slide deck and the recording once it's processed, likely early next week, to everybody who is registered. So you should be receiving that. And so with that, any final closing thoughts, Peter or Alex?
The only thing I would say to all of you is, first of all, thank you for coming to this webinar and listening to us for the last hour. This is changing all the time. And so anything and everything that we say today, keep your eyes and ears open for modifications that come from, like, for example, I understand the governor is speaking at noon today on something that that might actually impact state law. We surmise it may have something to do with impacting CFRA leave. So adopt all these policies and templates and other things that you're doing, but also keep in mind that, since this is ever changing, you might need to make modifications pretty quickly.
Perfect. That's a very good point. So with that, Alex, Peter, thank you so much for presenting this morning. We really appreciate your sharing your experience and expertise with all of us. And thank you to all of you who attended. Have a great rest of your day.